Hey everyone, I am the nurse doc, and today we will be inserting a straight cath on a male patient. So what do you need for this? You need a in and out cath set, and you want to make sure that it has sterile gloves in it. I always say, rule of thumb, always check your packaging to make sure you have everything that you need. All right, and you need a male patient, so we have a male patient here. So what you're going to do first is you want to make sure you identify the patient and check the order. Make sure that you're doing this procedure on the correct patient. So why would a patient need a straight cath, as we call it, in and out cath, straight cath? This be used interchangeably, but we would do this if your patient is suffering with urinary retention. All right, so they're not able to pee on their own. All right, so first what you want to do is you want to make sure that you clean the penis. So you can get some soap and water just to clean the penis, or you can use some bath wipes. But we always want to make sure that we get this area as clean as possible, because this is a sterile procedure. Okay, so we're going to clean our patient. Now our patient is nice and clean, and we want to let our patient know what we're going to do. So we let them know, like, hey, there is a little tube that is going to go in your penis, and it will go to your bladder, and it will then release the urine. So you want to let them know that this may be uncomfortable. You don't want to lie. You want to let them know what to expect, that you may feel some discomfort, but we're going to get through this as quick as possible. So we've already verified our patient. We verified our order. We already cleaned our patient, and now we're ready to start. So after we washed our hands, it is now time to put on the sterile gloves, okay? All right. So we're going to open our container, and we're going to open it away from us, okay? And your sterile gloves should be on top. So remember, if the sterile gloves were not on top, we could not dig through the sterile kit with our non-sterile hands. So with most kits, your sterile gloves are right on top. And I also will suggest bringing an extra pair of sterile gloves in case you break sterile while you're trying to put on your gloves, or in case they're just not the right size and you don't want to have to start all over. All right, so we got our sterile gloves, so we're just gonna open it like this. All right, we're gonna bend our corners back, and then we're gonna open up our kit. Open up our gloves, I'm sorry. All right, so now I'm gonna pick up the right glove with my non-dominant hand. So I'm just gonna pinch the little cuff right here, and I'm just gonna put it on my hand, making sure to keep my thumb tucked and my fingers not touching the glove. So the part that my finger was touching was the inside of the cuff, which would be on your skin. All right, so then you're gonna take your right hand, and then you're gonna go under the cuff on the left glove. And you're going to scoop it like this, okay? So this glove is sterile and this hand is sterile. That's why we're able to touch it. All right, so then we're going to make sure you tuck your thumb, and we're going to put them on. All right, so you now have your sterile gloves on. So what can we not do now that we have sterile gloves on? So we must keep our hands above our waist, and we must only touch sterile things. Once we touch something that is non-sterile, we are considered unsterile, and we would have to switch gloves, okay? All right, now we got our gloves on. We can now touch everything that is in our sterile kit. So we have a specimen container, which we don't need, so I'll just set that to the side. And then we have our fenestrated drape, which we'll put on the patient. We have some swabs, and we have some lube and the catheter. So let's go ahead and put the drape on the patient. So we want to open up the drape. And we're going to put the shiny side. We're going to make sure the shiny side is down, okay? So we're going to put this drape over the patient. All right, so now let's get to work. So we got our 3 cleaning swabs, and then we got our lube and our catheter. So this time you want to go ahead and prep all the things that you're going to do. So we're going to go ahead and open up our cleansing swabs. being careful not to waste anything because we don't want our sterile field wet. All right, so then I'm gonna open up the lube. Ooh, this lube is hard to open. There we go. All right, so we're gonna drop that, and then I'm gonna grab the tube. Wait, let me maneuver this out the way. All right, so I'm then gonna grab the catheter, and then I'm gonna place the catheter in the lube, okay, while we wait. So I'm gonna go ahead and get that all lubed up, and then I'm gonna sit it in there. All right, so now I'm gonna grab my cleansing swabs. So now this is where it gets tricky. So you're gonna take your non-dominant hand and you're gonna place it on the penis, okay? And we're gonna hold it at a 90-degree angle. So we have touched the patient with that sterile glove, right? So that hand is no longer sterile, okay? So that hand cannot touch anything in the kit. So now we're going to be doing everything with one hand. So you want to make sure that you chose your dominant hand. All right, so we're going to grab a swab. And I could have made this easier by actually pulling them out the container. All right, so we got one swab. So what we're going to do is, I like to start down like at that bottom part right here, and I like to make us go around in a circle. So one complete circle, toss it in the trash, go back to your other swab, and I'll come up some more, right? Complete circle, toss it in the trash, and then I'll go for my last swab. All right, and then I will toss that in a circle. All right, so now this hand is still sterile, so now we're ready to begin. So we've already cleaned the patient. We have our catheter already in the lube. All right, so you want to let the patient know, hey, you will feel some pressure. So I got the cath in my hand, right? And it's all lubed up, as you can see. So you want to make sure that this catheter doesn't touch you, doesn't touch the anything. You want to keep it sterile, okay? So you want to tell your patient, hey, you're going to feel some pressure, and if you can bear down, can you do that? All right, so we're going to go in, keep going until we get urine return. So one thing about the men you can't be afraid is that you will almost put the whole tube in the patient until you see urine return. So don't be alarmed if you're like, oh my God, I haven't got back urine yet. All right, so once we got the flash of urine and the stream of urine, we want to now stop inserting it, and then we want to put this part, we're going to let it drain into our container. If you had a urinal nearby, you could then use the urinal. So we want to just keep this in until the patient is, until the urine has stopped. What I like to do is I like to palpate the bladder, and that will push some of the urine out. All right, so now that the patient is finished, we want to tell the patient to, all right, I'm going to take it out, take a deep breath in, and then we're just going to pull it out the patient. All righty, so this is how you insert a straight cath. So what is the difference between a straight cath and a Foley catheter? So with the Foley catheter, that stays in the patient. When you have an intermittent cath, we literally just stick it in to get the urine and then pull it out after we got the urine. So now what you want to do is you want to clean your patient up, and then you want to measure your output and document the amount and the color. You also then can bladder scan your patient to make sure that you got all the urine out. I hope this video made straight catheterization easier for you to understand.